Hi, I'm presenting Miss Wells, a 28-year-old African American female with a history of asthma diagnosed in early childhood. She presents today after a near asthma exacerbation 2 days ago triggered by exposure to cats. During that episode, she experienced wheezing, rated 6 out of 10, and shortness of breath, rated 8 out of 10, lasting about 5 minutes. She used her albuterol inhaler with only partial relief. Since then, she reports ongoing symptoms, including 10 episodes of wheezing and shortness of breath every 4 hours. She reports waking up at night with shortness of breath twice per night, along with a non productive cough. Her symptoms are worsened by movement and by lying flat and are now interfering with her daily activities. She also feels that her albuterol inhaler is becoming less effective. On exam, she is not in acute distress, alert oriented. Lung exam reveals bilateral expiratory wheezes in the posterior lower lobes without crackles. Her oxygen saturation is 97%. Spirometry shows an FEV1/FVC ratio of 80.5%, which is within normal limits. She has a history of 5 prior asthma hospitalizations with no history of intubation, and she currently doesn't follow with a specialist. On assessment, this presentation is consistent with poorly controlled persistent asthma, acute asthma exacerbation. The plan, based on the Global Initiative for Asthma, I would initiate her on the third step therapy, a low dose ICS, LABA combination inhaler, preferably formoterol based, used both as maintenance and reliever therapy. Per the GINA guidelines, using ICS as the reliever reduces the risk of exacerbations compared with using a SABA reliever, and it's a simpler regimen. I would discontinue the SABA only use and transition to ICS and formoterol as needed. I would also provide education on trigger avoidance, especially pet dander, and reinforce proper inhaler techniques. And follow-up would be scheduled in 2 to 4 weeks. And I would also consider a referral to pulmonology or allergy due to poorly controlled asthma and history of exacerbations. Overall, the goal is to improve her symptoms and to prevent further exacerbations.